starting over for you?
Yeah, sometimes it happens with the platform. I do apologize.
Okay, so there'll be some missing information, unfortunately. But the first objective was to perform systematic reviews on the international incidence and prevalence of all of the conditions. Our second objective was to summarize and make recommendation as to what is the best way to identify each of the neurological condition if we wanted to do surveillance to be able to track them and understand the burden of these conditions. And the final objective was to develop an inventory of existing neurological registries in Canada. So let me move to some of the study results. So we'll first focus on the first objective, and I apologize. Actually, all the the slides are not showing up properly, but we'll see how it goes. Yeah, there's a lot of missing information, but that's okay. So before I give you some of the results in terms of the incidence and prevalence of each of the conditions, there are just some things to keep in mind. It can be quite challenging, and ideally we would have liked to be able to tell all our colleagues, researchers, and the neurological health charities, this is how many people are affected by the condition. This is how many 2-year-olds are affected by this, 3, 4, 5, all the different age groups. Unfortunately, when you look at national and international studies, you often aren't provided such detailed information. So we were dealing with different years of data, different world region, different settings. So there's some countries included all the long-term care institution, and we still captured that information. But of course, in some of those studies, community-based individuals were not included. The ascertainment sources to identify the different patients were different. There were different diagnostic criteria. For example, for dementia, there were up to 20 or 25